Good morning, everyone. Today we discuss about the some clinical procedure used routinely for the administration of the different medications. These are the intramuscular injection, intravenous injection, and lumbar puncture. First of all, we discuss about the intramuscular injection. What are the steps and how we introduce the injection of any medication. Intramuscular injection, it is the injection of a substance directly into the muscle. In medicine, it is one of the several alternative methods for the administration of the medications. First of all, discuss about the which type of muscles are responsible for the, or we can say, site for the intramuscular injection. So, muscle having a larger and more blood vessels than the subcutaneous tissue. So, injection here usually have a faster rate of absorption than the subcutaneous injection or intradermal injection. So depending on the injection site, any administration is limited about 2 to 5 milliliter of the fluid. Now, preferred location for the intramuscular injection, including the deltoid muscle in case of upper limb, then gluteal region, particularly the dorsogluteal aspect as well as ventrogluteal aspect, and vastus lateralis in case of children. Now also we have to see that any area of the injection site is not any inflamed or swollen, or it may be red, tender, bruise, or any scar occurs, so that can be avoided. And the injection site is cleansed with the antimicrobial, and then it is allowed to dry. Now it is the injection with the dominant hand, using a quick and darting motion perpendicular to the person's body, about 70 to 90 degree angle. So it is a faster injection and it is less painful. Now needle is then stabilized with the non-dominant hand, while the dominant hand slides the plunger of the syringe to slowly instill the medication as a rapid injection, and that causes the rapid injection causes the more discomfort to the patient. Now the technique of the intramuscular injection. So these are the some steps, about 10 to 12 steps for the intramuscular injection. First of all, thoroughly wash the hands, then reassure the patient and explain the patient about the any procedure, either intramuscular or intravenous injection. Then the injected site, that is deltoid region or gluteal region or vastus lateralis region. So first of all, uncover the area to be injected, whether it is lateral upper quadrant major gluteal muscle, whether it is lateral side of upper leg, or whether it is deltoid muscle. Then first of all, disinfect the skin with the spirit soap and tell the patient to relax the muscle. Then insert the needle swiftly at angle of about 90 degree with to see about how depth needle is inserted inside the skin. Then aspirate briefly. If blood appears, withdraw the needle. Then replace it with new one if possible, and then start again from the step 4. Disinfect the skin, then tell the patient to relax the muscle, then at 90 degree insert the needle. Then 8th step is for the less painful to the patient. It is always keep in mind that to slowly inject the medication. Then withdraw the needle swiftly. Then press sterile cotton wool onto the opening side and then fix with adhesive tape. Now check the patient's reaction at that time and give additional reassurance if any required. Then clean up and dispose the waste safely and wash your hands again. So these are the multiple steps for the procedure of the intramuscular injection. This diagram showing the multiple gauze needles are available. If the gauze is larger, then size is smaller. For example, 24 gauze needle having a smallest size. So there are in the market 18 to 24 gauze needle are available. So this is the picture of gauze of the needle syringe. The diagram showing the intramuscular injection site, that is about 90 degree angle. We have to insert the needle into the body of the patient, so that pierce the skin, subcutaneous tissue, and lastly intramuscular injection, so it needle is inside the muscle at least. So this diagram also showing the at 90 degree, about 70 to 90 degree angle can be maintained for the injection. Preferred site for the intramuscular injection. So this diagram showing the dorsogluteal as well as ventrogluteal region, deltoid region, and vastus lateralis. Vastus lateralis is a preferred site in case of children for the vaccination purpose. 5 sites acceptable for the intramuscular injection. The first is the deltoid muscle of the upper arm. It is a preferred site for the vaccination in case of adults. So in today's era, corona vaccines are available, so we can take corona vaccine in the deltoid muscle. Now dorsogluteal, it is performed by entering through the gluteus maximus muscle, but here care should be taken, that is to avoid damage to the sciatic nerve as well as vessels surrounding this area. So safer and preferred site is the ventrogluteal region, outer quadrant of the gluteal region, which access the gluteus medius and minimus muscle. So it is a primary location for the intramuscular use as it avoids all the major nerves and blood vessels. So procedure: first of all, aseptical materials prepare before, then check the label of the drug at least 3 times, then prepare the medication, then position of the patient and locate the site correctly, then cleanse the site using circular motion from inner to outer portion and then allow it to dry. Then place a spirit soap between the fingers of the non-dominant hand, and also the pinch this or spread the tissue and insert the needle quickly at 90 degrees angle in a dart-like position. Diagram showing the intramuscular injection site, particularly in the gluteal region. So that is between this index finger and middle finger. It is the anterior superior spine, this one is, and just below this is a preferred site for the intramuscular injection, that is called the outer quadrant of the gluteal region. Outer quadrant is 1, 2, 3 and 4. These are the inner quadrant, outer upper quadrant of the gluteal region. So it is a preferred site as it avoids any passage of the nerves and blood vessels. This diagram also showing the posterior view of the gluteal region. So this one is the preferred site, outer upper quadrant, between these 2 fingers and between these 2 fingers, between the knuckle of the index and middle finger, where there is a location of the gluteus medius muscle. In case of adult, deltoid muscle is the preferred site for the intramuscular injection. So this is the deltoid muscle. Here in the lower part of the deltoid, we have to inject. So location of the intramuscular injection in deltoid muscle. So it is the easiest method to locate the intramuscular injection site for the deltoid muscle is between the finger. So this diagram showing the middle 1/3 portion. Injection site for this method is located in the middle 1/3 of this triangle. So it is sometimes easier to make the triangle with the fingers as shown in the diagram. In case of vastus lateralis, intramuscular injection, particularly in case of children. So correct place to give the shot in the thigh for children is in this way. So vastus lateralis on the lateral view, lateral aspect, that can be given, particularly in the children. So this diagram showing the vastus lateralis location. This one is the injection area. Here biceps femoris, vastus lateralis and rectus femoris. So injection can be given here, particularly in the young children. This is the site of the intramuscular injection that make about 90 degree angle. In case of subcutaneous injection can be given just below the skin within the subcutaneous tissue within the dermis, so that make about 45 degree angle. In case of intravenous injection, that is given about 25 degree angle, and that can be given directly within the vein, intravenous. Intradermal, just below the skin, make about 10 to 15 degrees just below the skin, intradermal injection. Intramuscular 90 degree, subcutaneous about 45 degree, intravenous about 25 degree, intradermal 10 to 15 degrees. So material needed: syringe with drug to be administered without air, means air can be come out. Then needle, particularly 20 gauge needle, it has the long and medium thickness, and on syringe. And there is a liquid disinfectant, cotton wool, adhesive tape, and tourniquet. Now technique same: wash your hand first, then reassure the patient and explain the procedure to the patient. Then uncover the arm completely. Have the patient relax first and then support his arm below the vein to be used. Here the vein is suitable vein is the median cubital vein of the arm that can be present in the cubital fossa. Then apply tourniquet and look for the suitable vein. Then wait for the vein to swell. Then disinfect the skin with the spirit soap. Then stabilize the vein by pulling the skin taut in the longitudinal direction of the vein. So do this with the hand you are not going to use for inserting the needle, means non-dominant hand. Then insert the needle at angle of about 35 degree or 25 to 35 degree. Then puncture the skin and move the needle slightly into the vein about 3 to 5 millimeter. Then hold the syringe and needle steady. Then aspirate. If blood appears, hold the syringe steady and you are in the vein. So if does not come out, try again. Then loosens the tourniquet. Then slowly inject the medication. Then check for any pain or swelling or any hematomarkers. If in doubt whether you are still in the vein, aspirate again. Then withdraw the needle swiftly. Press the sterile cotton wool into the opening side. Then secure with adhesive tape. And then check the patient's reaction and give additional reassurance if required. Then clean up and dispose the waste safely and wash your hands again. So these are the steps for the intravenous procedure. Either we can collect the blood for the blood transfusion, or for the any investigative purpose we can collect the blood, and also we give intravenous injection or IV infusion. So it is the vein of the choice, that is the median cubital vein. Median cubital vein is obliquely present in the cubital fossa, which connect the cephalic vein to the basilic vein. This diagram showing the venipuncture. Now lumbar puncture. Lumbar puncture can be done to obtain the cerebrospinal fluid from the subarachnoid space that is present around the spinal cord, and typically that can be done between the L3 L4 or L4 L5 intervertebral space between L3 and L4 and L4 and L5, and that is inferior to the spinal cord, because usually spinal cord ends at the level of about L1. So below the L1, within this subarachnoid space, the space containing the large pool of cerebrospinal fluid. So between L3 and L4, it is the preferred site for the obtain of the collection of the cerebrospinal fluid, because there is an expanded subarachnoid space inferior to the spinal cord, that is called as a lumbar system. This one is the subarachnoid space. So within this space we can have to collect the cerebrospinal fluid. Now preparation of the patient. It is the local anesthesia can be given for the lumbar puncture. The two position of the patient, either sitting position or lying down position, right or left, lateral recumbent position. So patient first of all is placed in the lateral recumbent position with hips, knees and chin flexed towards the chest, so to open the intralaminar space or interspinous distance, and then pillow may be used to support the head. Okay, so this is the lumbar puncture site. Position is either lateral recumbent or sitting posture, and CSF can be collected for the cell count, protein, glucose and microbiology. Also to check the CSF pressure. Also CSF can be removed and either can be introduce any local anesthetic drug. Needle of the lumbar puncture is a longer one. So this diagram showing the stellate and needle of the lumbar puncture. Two types of needle are there, standard and atraumatic needle. Here there is how the sterile strap is put on the body of the patients. This diagram showing the spinal tap between L3 and L4. This is the needle of the lumbar puncture that can be introduced subaerial space between L3 and L4. More diagrams showing the lumbar puncture site, how the CSF can enter the container through this lumbar puncture needle. Normally, CSF pressure is below 15 millimeter mercury. Abnormal means pressure is more than 15 millimeter mercury. So there is also this CSF pressure reading is there along with this lumbar puncture needle. So this lumbar puncture needle can be introduced by resistance this particular area and finally enter the subaerial space. Finally, the indication of the CSF means lumbar puncture. It can be diagnostic as well as therapeutic. For the diagnostic purpose, how lumbar puncture can be done, that is for the diagnosis of the infectious disease like meningitis, encephalitis, then inflammatory disease like Guillain-Barré syndrome and multiple sclerosis, and for also for purpose for the oncologic diagnostic, any metabolic disorders are there, or any hemorrhagic condition is there, spontaneous subarachnoid hemorrhage is there. So these are the indication for the diagnostic purpose of the disease that can be used. And therapeutic purpose, how lumbar puncture can be done, that is for the to relieve the pain as analgesia, to give anesthetic drugs as anesthesia, and to introduce the antibiotics as well as anti-cancer drugs like anti-neoplastic drugs. So lumbar puncture can be done both for the diagnostic purpose as well as therapeutic purpose. So these are the different techniques. Clinically, there can be used for the administration of the medication in medicine. Thank you.